The following is a local resident producer's program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Media Services, the City of Oshkosh, or Time Warner Cable.
Hi everybody, welcome to On Oshkosh. Cheryl Hentz here. Dan is not with us tonight, but he'll be back hopefully during the next show. I want to just give you some figures real quick here. October is Breast Cancer Awareness Month, and we always try and do a show like this prior to that. And should state also, breast cancer, of course, can strike at any time. In 2010, there were 4,210 new cases of breast cancer in the state of Wisconsin, and there were to be expected, anyway, to be just over 207,000 new cases of invasive breast cancer throughout the country last year. In addition, there were projected to be 54,010 new cases of skin breast cancer diagnosed last year in this country. Likewise, it was expected that 40,230 breast cancer deaths would occur throughout the U.S. last year, of which, and these were some surprising numbers, 39,840 were women and 390 were men. Given our technology today and awareness we try to do in this country, those figures are still too high. But the good news is breast cancer death rates have been declining steadily over the years, and we're going to talk about all of this information tonight with our guests. On my right is Cindy Endress. She is a mammography lead at Aurora. Is it Medical Center, Aurora Health Clinic? What is its official
We're the
name?
hospital, so that we are Aurora Medical Center.
Aurora Medical Center, okay. And also with us on my left is Ann Lenz, and she is a mammographer. And she also fits women who have had mastectomies with prosthetics, and they've both been here before. One was here, you were here last year, right?
Last year,
and you were here the year before that.
I was.
So, and now you're both here tonight.
Together.
Normally Becky Christensen is here with us also. She's a nursing supervisor at Aurora. Also a breast cancer survivor. She's got a daughter who's getting married, and so she couldn't be here tonight. But these lovely ladies are going to fill in for her and share their expertise with us. And we're going to talk about the things that that Becky has talked about in the past as well. So full show. You know, these statistics, the numbers still are too high. You know, even though awareness is done over and over and over again. And something else that surprised me, and I have to refer to my notes on this. According to National Health Interview Survey, mammography rates in women 40 and older dropped from 70.1% in 2000 to 66.4% in 2005, and that's the last year that I could find numbers for. Mm-hmm. Why? Let's start there. I mean, since we're trying to do so much awareness, and breast cancer deaths have been declining slightly, mm-hmm. and they say that the older you get, the more mm-hmm. important mammograms right. are. Why do you ladies think the number of people having mammograms when they're 40 and over is declining?
That's a really good question.
Part of it right now, of course, with the economy, people mm-hmm. are losing their insurance, so they don't have coverage. I think that's a really big thing right mm-hmm. now.
Right.
Or their insurance has changed according to the task force guidelines that came out a couple years ago, mm-hmm. November now, mm-hmm. where some insurances are maybe only paying every other year, mm-hmm. not yearly. which used to be years ago.
Yeah.
We used to be every other year from 40 or from 50 on, and
Right.
and nothing before that. But then we changed it, or they changed it to yearly, and then that's when all these numbers came out where, wow, we're doing great things. The numbers are dropping. You know, we're finding it early. People aren't dying so much. But now they seem to be changing it back, or they're recommending it back. American Cancer Society and the American College of Radiology both still recommend yearly. But, you know, people are going to go with what their insurance covers.
So let's talk about that a little bit, because you know you've got one institution or agency saying one thing, you've got someone else saying another. What do the insurance companies really go with, and what's the criteria they look at? I suppose they go with the one that's going to cost them the least amount of money.
Or what Medicare recommends. Some insurance companies don't make the investment into making up their own guidelines.
Yeah.
They'll just say, well, if Medicare covers it, that's what we'll cover as well. And, you know, they're going to be the driving force, and with the task force being a governmental thing, you know, I don't know. They haven't made changes yet. They still will pay, Medicare will still pay for a mammogram yearly, and this year started paying for the entire 100%, where in the past that hasn't been. But you still got to get the women in the door.
Yeah, yeah. And we should also say there is an organization out there, if your insurance doesn't cover mammograms or you don't have any insurance, there is an organization that is for women in Wisconsin. Let's talk a little bit about that, because they can apply. Now, I don't know what their criteria is. I think you have to be at a certain income level.
Right.
But, you know, I mean, there's always exceptions to every rule, and I would think that if a woman needs to have a mammogram and her insurance won't cover it, they might be able to do something. But let's talk, who wants to talk about that organization?
I think it's fairly easy to contact them. I know there's a contact person, I'm not quite sure of her name.
Kristen.
And then I believe she gets the right paperwork, of course. There's probably paperwork involved. But I believe they cover mammograms and PAPs.
They do.
For people that don't have
them on, I
insurance.
think, once before, a few
Right.
years back. It's the Wisconsin Well Woman program.
Right.
And I think they've got a website that if you just type in Wisconsin Well Woman program, it'll come up, and or you can send us an email too, and I can get you the information. But you're right. They do cover PAPs and breast cancer,
Right.
screenings, if you
Right.
will.
Right.
So.
And that's just a nice option if there's no insurance, or if a woman has a breast lump or a breast problem, they could contact them, like you said, with email or phone call. And I'm sure they would I believe they almost may make the appointment too. I'm not sure on that. But we've had really a good experience with that.
I believe even if you call 211 United Way, they'll connect them as well.
Oh, okay. All right. 211. All right. Let's go back. When the state budget was approved, it really sliced a lot of money out for women's health care.
Right.
Are you seeing any fallout from that yet? I can't imagine that you would be seeing it yet, but you might be seeing some later on.
Our numbers are actually up this year.
Right. We've been very busy this year. We do screening mammograms every 15 minutes with one digital machine, which is a great machine. But we've been very busy, I have to say, this year. So hopefully that's not in our future.
Well, hopefully that'll stay.
Right.
But, because I mean, women's insurance is changing,
Yes,
and women's
exactly.
health care has been hit by these cuts.
Right.
And so many people still don't know how any of this is really going to play out.
I know.
I mean, even local governments don't know.
Right.
For
Right.
sure,
I know.
what's being cut.
It's kind of
So
scary.
It is.
I know
It is.
what's going to happen next year, what's going to be
And maybe
covered.
we're busy because of that. Maybe they're getting in and getting
Right.
the mammograms before they don't know if they're not going to have insurance.
Right.
Or
Right.
anything else might change.
Sure.
Cutbacks.
Well, like I said in the opening, we try and do this show every year around this time,
Right,
and
that's great.
some of you maybe have seen a show like this in the past, one of the past ones that we've done in the last 2 years, but there's always new information. Always good to have a reminder or a refresher of certain things. So we hope that you'll stay tuned. And for those who have never seen one of the shows we've done on breast cancer awareness in the past, hopefully it'll be informational for you as well. So don't touch that dial. Okay, so let's talk about mammography. What are the guidelines? We kind of touched on that a little bit, but when should someone go in and have their first mammogram? Let's start there.
The American Cancer Society recommends age 40 to start. If there's a family history, if their mother or grandmother have a family history, then they can start younger. There's not, a set age of 40. Isn't there something with if the mother has it at a young age, in her 20s or early 30s, then she may start her screening early.
Okay.
It's if your mother had it when she was 43, you should start when you're 33.
30, so 10
you want to do
years.
that
Okay.
10-year difference, and get in there and get your first one at least. And the radiologists are doing much more recommending and looking at the family history and the type of breast tissue that a woman has, if they're very dense tissue, or if they do have a strong history, they may also recommend MRI as a follow-up. That whereas a mammogram shows the anatomy of the breast, an MRI is going to show the function, how it's working. But there's still plenty of denials out there for that, even when they do recommend it.
Sure. And so a mammogram, you can detect something on a mammogram that is very, very small, correct?
Right.
How small are we talking?
I'd say a little bit.
Contact bracelet.
Yeah, we should have.
We have a necklace that has beads on it, and the biggest bead is about the size of a golf ball.
Okay.
And they say that that's the size if you don't do
If
self-exam.
you don't do exams, right.
The size of like a fingertip would be if you perform them every month. If you go to the doctor and he could find a lump even smaller than that, your first mammogram could find one, the size of maybe the small early peas that you would see in the grocery store. If you have a yearly mammogram and keep going and you can see the changes in the breast from the prior mammograms, which is always important to have, you can find them, like the size of a small diamond.
Okay. And so for women who haven't had one yet, talk a little bit about what's involved in having a mammogram. It doesn't take that long.
No, it doesn't. And I think that I think we offer appointments as early as 6:30. You can have your mammogram at 6:30 in the morning.
Before you go to work.
Before
Yay.
you go to work.
What a way to start the day.
Well, it really is. Instead of thinking, I have a mammogram at 3:30 or 4 o'clock, and that I think builds up anxiety. Yeah. If you get up, get that mammogram done, and it's over, you're in and out of having a mammogram within. Well, we schedule them, like I said, every 15 minutes, and we're not. It's not like an assembly line. All of us, we have several technologists. We get a full history. It just does not take that long to actually do the procedure. There's really nothing to it. It's you come in, get registered, of course, and the actual exam itself takes minutes, and then you're done. We also now are offering same-day results. So if you want your results, if your mammogram is scheduled before 3 o'clock, we can give you a call that day.
Okay.
So that is a great
And if
great
it's later
service.
and the radiologist is gone, then as soon as it is read, we'll give you a call.
Right.
Probably the next morning.
Right.
But I have clocked it. I've gone in and looked from the time of the first picture taken to the last. It's always like within 5 minutes. So the picture taking is a very small part of it.
Right. It
4 to
really
6
is.
pictures, and-
Right. It used to be when we had to develop the film, and then, we'd schedule it every half an hour. And I think the longer you're there, the longer you're sitting in that chair waiting to see if the pictures are okay, that's all anxiety. But, now they come up on the monitor. We see them. We take, if we need an extra picture, not because we think we see something, but if we didn't get all of the breast tissue, we can take that picture right then and there, and they're still ready to go to work, right 15 minutes later.
Yeah.
So,
Or if somebody
nice.
breathes when they're not supposed to breathe, or they
Yes.
slightly move,
Right.
that throws
Yes.
everything off, and
That's
then you have to
right.
get another one.
Now, why
Right.
would you move? If we tell you not to move,
I wouldn't, but someone.
okay.
And, you know, there is slight discomfort involved.
Right.
But, you know, when you compare that
Right.
with what you're going to go through if you don't have a mammogram and
Right.
then end up getting cancer,
Right.
it's a very
It's-
small price to pay,
it's
and it
small.
only lasts seconds.
And you know,
yeah,
go ahead.
we do use the mammo pad, which is a little cushion.
Right.
So that adds a little cushion underneath. And plus, with the digital machine, the paddles are made differently. The paddles that come down are not just a stiff paddle. They come down and then they start to flex to the shape of the breast. So, you know, a
It gets
lot
a
of
great
women will
picture,
say,
but
will
it's,
say
it's
this
more
was nothing.
comfortable. Right.
Now, I've not heard of that before. I use a different facility. I'm sorry.
At least you're
I have-
going.
Yes,
well, I am,
right.
and I have used Aurora for several other things.
Sure.
So I try and spread my stuff around.
Yes,
Spread the
well,
love.
that's good.
Share the love.
That's right. So I've not had that experience before that I'm aware of, where
Sure.
something is flexing, but that
Okay.
would be great.
Right. Right.
So, okay, and so seconds of discomfort, if that. And
Right.
it all depends on the size of your breast also, as to how much discomfort
The
you
density.
may or may
The
not feel.
density. Right.
You know. So in same-day results, that's a good thing. And sometimes those results, and I think it's probably happening with greater frequency now, where women are getting callbacks to come back in, and that freaks a
It
lot
does.
of us
It
out.
does. It
You
does.
know?
It does.
And
Right.
so what would be the reasons why a woman is getting called back? It doesn't necessarily have to be doom and gloom. And
No,
usually it's
not
not.
at all.
No, usually it's not. Right.
So it could be just a matter, and the importance of having the priors is the prior exams is always there. So if you hang up your old films and the new films and an area looks just a little different, is she going through some changes? Is it something real? Is it a different angle? The breast is so mobile. I mean, if you look at this and you start turning it, you're going to get a different picture each time. So obviously we try to all take the pictures the same way and get the exact same picture and duplicate the year before. And if everything matches up, awesome. If there's a change or something new, then he's going to question that, and we're going to get you back in and get another picture. Could also be, you know, calcifications can develop in the breast. I mean, the breast makes calcium, that's its job. And there can be some deposited in there. Some early cancers do look like that, so we always just want to be careful and get a double look at it and maybe do magnified pictures. You know, I know often people think, oh, she screwed up, or she didn't take enough pictures, or we would. That's
Right.
why we check them while you're there, and as
Yeah.
the images come up, and we would reshoot. So it's either something's been seen, or you know, sometimes if we found, like if someone has a rash or something, they maybe been putting a certain cream on. Some creams will have things in it that will look like calcifications. So, you know, maybe come back in, we need to do an extra careful scrub of the skin and make sure there's nothing hiding, or some moles will capture powders in them and they will show up as well. So it's just a more thorough, what we call a diagnostic mammogram. So often, you know, that I think what people also get upset is that your insurance, you know, may cover a screening mammogram, but then that's now a diagnostic mammogram. So if you haven't met your deductible, yeah, it's gonna be a ding on your deductible, and if it's gonna cost.
Yeah. But again,
But you wanna be
much
sure.
less than if
Right.
you know you were
And you wanna catch
Right.
it early.
diagnosed with cancer. Yeah.
Right. I want to just tell you something that
Sure.
I remember last year with Becky Christensen. She said she never wanted to take the time to get a mammogram done. She never had time, just like all of us. We're all so busy.
Yeah.
And then she had the mammogram, and then all the appointments and everything after a person does have a diagnosis. Just take that 15 minutes and come in and just get that done. I know a lot of it is anxiety and fear, just like any doctor appointment. Who likes to go to the doctor? But when you do go, you feel a lot better, and you can get those results the same day and put your fear at ease.
Yeah, for the next
next year.
Well, and with Becky, I think she said she put it off for 8 years.
Okay, I can't remember how
that's-
long.
It was too long.
It was a
Yeah.
long time, and you know, I remember her saying she doesn't mind admitting that she really screwed up big time. I mean, and this is a nursing supervisor,
Right.
You know,
It
But I
hasn't
think
slowed her
that's-
any, though.
I think
Yeah.
that happens with everybody. We all say, I'm too busy to do that right now.
Yeah.
I'll do that
Yeah.
next month, or I'll do it 2 months from now. Just like anything. But
Yeah.
but it's so easy just to come in, and we have so many slots during the day because we do them so often. And we're all very capable because we do so many of them that I think our staff is excellent at doing mammography. And we have 2 radiologists, Dr. Wong and Dr. Walker, that read them, and they're both excellent at reading mammograms.
Yeah.
So
And if they do get called back, because we have available slots we save for those type of exams, you can usually get in a day or 2.
right, that's
Which is
true.
important
Which-
because if you've gotten a call back,
Yeah, you don't want to
that
wait.
makes you even more anxious.
And some
you
come in
don't
the
wanna
same
wait
day,
either. Yeah.
later in the day.
Yeah.
So
Right.
Well, with Becky, you know, we should also make the point that not only did she wait all those years, but when she finally did go in, she was diagnosed. It was stage 4 already, right? I think it was
I'm
stage
not
4.
sure.
I'm not
I'm
sure.
not
I mean,
sure.
it was about as bad as it could get.
Sure.
But that was a number of years ago, and,
Right.
and you know, she had chemo and I think radiation, and everything was successful.
Right.
And you know, she's a great. I'm sorry she can't be here.
I
know,
tonight.
she's wonderful.
But I'm sure she's having a lot of fun, though.
Oh yeah, yeah. You know, and I want to touch on something that we were just talking about here with the callbacks. You know, a few times in my life, I've had callbacks, and it is kind of a freaky thing.
It is.
It really is. It's very nerve-wracking. The first time I was half crazed when that call came.
Yep.
And actually, I think I got a letter at that point because it was a number of years ago, and I think it came by letter, and I called right away, and then I really started freaking out.
Right.
And it turned out to be absolutely nothing. Then the second time that it came, I thought, well, okay, this is not a big deal, and I
Right.
just called, went back in, it was fine. This last year, well, actually, it was this year, but the last time that I went in, they called me, and it was the calcification thing. And they said, we need to have you come back in. We saw something. And so right away, I
Yes.
started freaking.
Well, you
because
can't help it.
of
It's just
those
natural,
words,
right.
you know?
Yep.
And I said, well, what did you see? You know?
Yeah.
And they actually
Typical.
used the word calcification. And so right away, I'm on the internet looking up calcification. And then I see that sometimes it can be cancer, and so then I'm just a nervous wreck. But I got in, you know, within probably a half a week,
Okay.
just a few days, and everything turned out to be just fine. Sorry about that. I was afraid that was going to happen. Didn't I say that before we started taping? I said,
Do you have time for this show? You're so busy.
I said, I didn't have a chance to turn that off, and now it's too late. And
Oh.
so anyway, but yeah, so they got me in fairly quickly, and it turned out to be absolutely nothing. And the way the radiologist explained it, he said, as you age, calcification occurs,
Sure.
sometimes at a greater rate. And they just wanted me to come back 6 months
to double
after
check.
to make sure that it was still the same size that it was.
Right.
And, you know, but things like that do freak a person out.
Oh, they do.
You know?
No matter what.
Yeah.
I
And
know.
we're women. We always go there.
You-
Everybody goes there.
You kind of think the
People-
worst if you
some
do
write
get
their
called back.
will,
I
you
know.
know.
Yeah.
I know. But
Yeah.
you know, also, let's just say someone is diagnosed with breast cancer. I don't think it's, of course, it's terrible, but there is so much out there that it's not a death sentence anymore. It really isn't.
much support.
There's so much support. There's so much good medicine, I want to say, that it's curable, really, or you know, to get it under control. It has come a long way, even as long as I've been doing mammography. I've seen a lot of changes, and which is great.
Yeah.
That it doesn't mean it's not as grim, I think, as
Yeah.
it used to be.
So when we see these numbers, you know, of deaths that are occurring and projected to occur, that's happening because people haven't gotten screenings when they should?
That could very well be. Yeah,
You know,
I don't know.
I mean, we can't actually say that breast cancer is 100% preventable, or can we say that?
We don't know what causes it.
Yeah.
And we don't know why some people get it and some don't.
And it seems like lately some people, some of the patients that I talk to, they say, do you think it's environmental? And you can't help but wonder, because it seems like there's so much out there, even with other cancers too.
Yeah.
Or people with same conditions or work in the same place.
Right.
I mean,
You just wonder what causes it.
I think as women, we try to solve everything.
Yeah.
Whether there's someone that does know the answer or not, we're going to solve it first.
Yeah.
Yeah.
But that's okay.
Yeah.
Yeah.
You know, when we gave these numbers here, some of them were men.
Right.
And I've only known one man in my lifetime who had breast cancer, and he did die from it. It's uncommon, but it's not.
But it does happen.
It's not
right?
unheard of. And I know when you guys have been on in the past, we've talked about the fact that you do have men who actually come in for screenings. And talk a little bit about men don't need to come in every year to be screened. At what point do you normally see men in your facility?
It seems like the men that we have for mammograms usually have pain. I have the men I have done, we don't do a whole lot, but the men we do have pain or a lump, which can also be caused from medication, like high blood pressure medication and a couple other medications can give a breast lump in a male patient.
Okay.
But yeah, breast cancer in men is rare, but it does happen. I don't really know the guidelines for if a man should, if there's strong family history. You know, another thing that I do want to tell you, just talking with the strong family history, is Ruth Ann Peck. Because since last year, did we have Ruth Ann last year? She's a wonderful person. She works with high-risk patients.
Now, she's someone who works
She's
at
a
Aurora?
PA,
Yeah.
Dr. Kiefer's physician's assistant.
Okay.
And she usually sees patients that have that are at high risk for breast cancer.
Okay.
Mother, grandmother, sister. I don't think we mentioned her last year.
No, that name doesn't sound familiar
No.
to me.
And she'll do a full workup, and often she's the one ordering the MRI follow-ups or even young women's diagnostic mammograms.
It's kind of nice if someone comes in for a mammogram and they say, oh, I have such a strong family history. Should I be doing anything else? And, you know, of course, their doctor will know about it, but having another person involved, like Ruth Ann, we give out her card, and so they have her phone number, or we call Ruth Ann and tell her about this patient. It's just another person that can oversee their care, their breast health, which I think is a wonderful thing to have at our facility.
Well,
Sure.
and through our questions and through even the researchers' questions, they've realized breast cancer, the BRCA1 and 2 genes, can be transported to the next generation through the male side of the family. So we do ask for family history for both men, or for both the mom side and the dad's. And you know, you asked about men. It used to be elderly men, but I know in the last year we've had a teenage boy, we've had a couple middle-aged guys, and a couple older. So it just depends. I mean, they just
All
need to be
who
aware
had
of their
it, or
body.
who were just
no,
coming
who
in
have
to
had
be screened?
mammograms, who
Okay.
we've screened.
All right. Well, let's talk a little bit about you know, how a mammogram is done for a male as opposed to a female, because obviously you don't have that, you know, the same anatomy. You don't have
Sure.
that kind of density that you're working with. So how do you screen a male as opposed to a female?
Really, it is the same.
It is.
It
Really?
really, it
There are
really
plenty
is.
of women that are the size of men,
Yeah,
and it's the same.
everyone has a little bit of breast
But
tissue.
men are not screening. Oh, they would never be a screening. It would
Yeah.
always be a diagnostic.
Okay,
Yeah.
so there's the
So,
difference.
Right,
Okay.
because
all right.
we take the two views, the top to bottom view and the side view. And a lot of the men, you can get quite a bit on the side view. You can see a lot of their muscle, but
It's not all muscle.
it's no, I guess it isn't.
Not on all of them.
And, I would think for a man walking into a mammography
Sure, it's embarrassing.
office
yeah,
or section of
uncomfortable.
your facility,
Sure.
it would be a little bit unnerving for them.
Sure.
And I know we've talked in the past about how that's handled.
Oh, sure.
So
Very-
can you address that?
Very professional. It is. We don't take them through the ladies' waiting room. I mean, we take them. We make sure no one is around really, and just get them in the room. And when we're done, put them in a different waiting area.
Okay.
So there's no one that would another patient that would even see him.
Wouldn't even know why he was there if
no,
you did see him.
absolutely
Probably.
not.
Okay.
No.
And the techs do a great job of coordinating with each other, saying, I have a gentleman, I'm going to take him in. Just hold your lady in the front room for now. And
Right. Right.
Okay. Let's talk about, because in doing some research for this show, I came across, terms like invasive breast cancer and skin breast cancer. Now, mammograms are screening for, and the diagnostic tests are looking for invasive breast cancer, correct?
Not always.
Okay.
It's looking for any cancer.
Any-
We don't know what type it is until
Okay.
the pathology comes
Okay.
back.
But it wouldn't be used to diagnose skin breast cancer, would it? Because that's on the outside? I mean, can't you
I'm really not
necessarily-
familiar with what
Okay.
information you've got for skin. If
Would that be like?
Paget's disease,
That's what I'm thinking.
Of the nipple?
So
Okay.
which can
right.
present as itchiness, redness,
Okay.
the
more of like
skin
an orange
peels
peel type
kinda.
of
Okay.
texture.
All right.
And often that will show up slightly on a mammogram as maybe the thickening of the skin.
Okay. All right.
I bet that's what they're talking about.
That
Right.
could be. Okay. And so if a woman is diagnosed with breast cancer, what are the next steps then? I realize it's kind of out of your field a little bit, but you've certainly, I'm sure, talked to patients, and through knowing Becky, you
Sure.
also know the next steps in the process of how this works.
We have Florette Rassi. She's our breast care coordinator, and she is with that patient through everything. Really, she's another wonderful person that we have at our breast center. She's with the patient because the patient would, of course, have a biopsy. So Florette would be there for that, and then going even to surgery. She'll go and just hold their hand for surgery, make sure they're doing okay, calls them. She makes sure that they never feel alone.
Yeah.
And she also, coordinates the time. She works a lot with Dr. Kiefer, our breast surgeon.
Okay.
Goes to their appointments. She works some long days just to go to those appointments, and she's a wonderful person to be with, new diagnosis. And then also with that, what Becky Christensen has done too with the bags. Each new diagnosis gets one of those.
Yeah,
Is that
we'll
right
talk
after
about
the
that.
surgery?
Yeah, we'll talk about
Yeah.
that a little bit later too, because she has, turned her situation into something, a
Positive.
very positive thing for women who are diagnosed. I want to talk about the biopsies for a minute, because that's also another tool in addition to an ultrasound or this diagnostic test. Sometimes there's a lump there that they're just not sure, and they may want to do a biopsy of it. And that, too, does not mean that you have breast cancer.
no, 80%
and
of the
you
time
shouldn't be
it's not.
freaking out over it. Even though, if somebody told me they needed to do a biopsy, that would probably send me through the roof.
I think just the word biopsy is scary.
Yeah.
I
you know.
scheduled
Yeah.
one today, and the gal said, "Yeah, I've had one before." Fine. How about Monday? So everyone approaches it differently.
Yeah.
Some will still be scared every time, but it's like an hour of their day, and they leave with a steri strip, and that stays on for a week. Little ice pack tucked in their bra. No one knows that they've had anything done. They're not sedated, other than just a local numbing medicine. And then
But
they
that
get the
can be very
results.
scary for women, even the process itself.
Oh, sure.
First you hear that you have to have one, and then the process itself.
Sure.
That's all a very
And the
scary
waiting.
process. Yeah.
The waiting for the results.
Yeah.
I think that's probably the
Well,
hardest part.
I think the worst was laying on the table waiting for the biopsy to even happen, because of course you want to do it all in a sterile environment. So there's so much setting up of supplies and sterile trays, and getting the doctor in the room and marking the spot you're going to biopsy, and scrubbing the skin, and then he gets his gloves on, and then finally it starts, and it lasts not even 5 minutes.
Yeah.
It's all that prep time.
And
Yeah.
then there's
And
the
all that
cleaning up
scary
and the
time,
holding
yes.
pressure, and
Just the
But
anxiety,
isn't
I
that
think.
the way it is with anything? I mean,
Yes.
look at Becky's daughter's wedding,
Prep and prep
Think
and
about
prep.
all
Yes.
the time spent planning and preparing and getting ready for, and it's over within an hour,
Yeah.
maybe 30 minutes, depending on what kind of a
Right.
ceremony or service you're having.
Yeah.
And then you've got a reception probably, and half a
Right.
day, and it's over with, and you've spent months and months, sometimes
Right.
longer than that, preparing.
money
So.
and-
Yeah.
Yes.
Yeah. So
Right,
that's the
right.
way it is with anything in life.
It is.
And when the patient gets their results from their biopsy, we do a standard of care with our breast surgeon, Dr. Kiefer, where if the diagnosis would be a cancer, when we call them with that information, and we do call, I know a lot of people will say, you don't have me come in. Well, if we said, if your results are fine, we'll call you. If they're positive, we'll have you come in. Really? You're going to drive in knowing that you're going to get bad news. I mean, that's just not safe. So we will call, and the radiologist actually will tell them. And then, we give them an hour or so. We can call them back after they've absorbed it a little bit. And we'll have an appointment ready for them to see Dr. Kiefer, either within, I think his standard that he strives for is within 72 hours.
Oh, that's
Often
great.
it's the next day or 48 hours later. And they go to see him, and he will decide how to go further according to how the pathology reads of those results. Some women will need a MRI, depending on whether there's what they call estrogen or progesterone receptive. And the MRI would say, is there more involvement other places in the breast that might have been missed on something else, or is the other breast involved as well? The trick, not the trick, but the goal now is to know as much information before ever going to the OR. So it's one trip to the OR, and we know everything that we're facing, and it's all taken care of at once.
Okay.
That's the goal. So some may, get that diagnosis and then end up, now I'm going to the doctor. Now I'm having an MRI. Now the MRI showed something, so we're going to do an ultrasound just to make sure. Maybe there's a lymph node that showed up enhanced on the MRI. Maybe we should biopsy that and see if there's lymph node involvement. I mean, we just want to know everything going. Plus, it helps the woman make the decision. Do I do just a lumpectomy? Or is it really involved, and a mastectomy is the best choice for me? So that all that is figured out. If they maybe need to go see the plastic surgeon as well, if they're going to decide to do reconstruction or an implant or something.
Okay.
You just want to know everything ahead of time, have that one surgery only,
Sure.
and move forward.
Okay. Want to go back to almost the beginning of our conversation when we were talking about self-exams. We didn't really talk about how to do a self-exam, and I know usually you guys aren't doctors and you don't play any here on TV.
Yeah.
But can you just talk a little bit about the proper way to do a self-exam? Because I know that there are younger people who watch this show as
Sure.
well, and maybe they've never done one, or no one's ever explained to them how to do it.
Sure.
Well, this is not the right way. You do not use the fingertips. You should use always the flat part of the hand.
Okay. All
So you're gonna, rub and start it. You can start at the nipple, and you would lay on your back with your the side you're going to examine behind your head, and a pillow or a towel under your shoulders also good. So you're going to lay really flat. Spread all the tissue out as flat almost as you can, and then just start and cover each area of the breast, feeling in circles, maybe pressing a little harder to feel the deeper tissues, depending on the breast size. And it's more so just knowing what your normal is. The same with the mammogram.
Right, and that's
One woman's
key, I think.
mammogram to another's, if you compared those two, it'd be like, oh, you must have something going on.
Right.
But it's what her normal is and what your normal is, and knowing what your own normal is. So when you go to the doctor and he said, oh, I feel something here, you can say, oh no, I've had that forever. It's
Right.
never changed.
That's probably
That's
the most
just me.
important thing right there, is knowing what your normal is.
Now, interesting, however, on that government task force, they recommend do not do any self-exam. So
now, why would someone recommend that?
not only do not get a mammogram, only every other year, and don't start till you're 50, and you can stop when you're 70. That's good enough. And don't do self-exam. Now, I don't know, maybe that's a whole nother show. Should the government be involved in healthcare? But
Well,
we know, and that's what's so frustrating, because you get so much information, you just don't know what to believe.
well, I mean, I'm grappling here with the fact that an agency or organization out there would say don't do a self-exam. I don't understand the reasoning behind
It's a task
that.
force of 11 people.
Okay, but I still
2
don't
doctors
understand
only.
it because it's not costing anybody any money.
Right.
You know.
Go ahead.
So
Self-examine.
what's the harm?
Right.
Now, you know, you said lay down with a pillow behind you and that kind of thing. Used to be, and maybe you still can do this, but you said to do it a different way. It used to be you could do it in the shower.
Oh, certainly.
So you
Right.
still can.
Well, however, and you don't, and it used to be, you know, mark your calendar, do it the same every month, do it
Right.
the same part of your cycle. It's just really, even the American Cancer Society has stopped making the video on how to do self-exam. They've gone to just paper print only, but it's really, you know, just maybe you do, everyone does your shower, don't they? In a routine fashion, you
Right.
wash the same thing first and then this. Just get a routine of, you know, your
Right.
hands nice and soapy, it can slide around.
Yes.
Just get a feel of what's normal for you.
Can I
You
say
know-
one thing on
Oh,
that too? I'm sorry
sure.
to interrupt
No.
you. I have some ladies, and I bet you do too, that they'll say, my breasts are so fibrous and so dense, I don't even do a self-exam because I would feel a lump every day if I would do one, which is true because some ladies do have fibrocystic, very dense breast tissue. But everyone should do a breast self-exam. Or cystic breast, I know
Sure.
that would be really hard to feel. You know, it's tough.
And
but
there's visual too. If you're standing naked in front of the mirror, just look.
right,
Is there a dimpling somewhere?
Right.
I know the video that we used to have would say, you know, put your hands on your hips and bend over.
Right.
Put your shoulders forward.
Right.
And just see
and it
if
really
they hang.
changes. It really,
See
yeah.
if they hang differently or do,
Yes.
you know, hanging. Most women hang. Some don't hang, but you know,
Right.
just what is your
check
normal?
the outside, dimpling or any.
Yeah.
If one all of a
anything
sudden got bigger
unusual.
than the other, you know,
Right.
what's that about?
Well, and so many different things can cause lumps also.
Right.
You know, I mean, they say a lot of caffeine can cause additional lumps in your
And
breasts
pain.
and so forth, and pain.
Right.
And I know that, I mean, I try and do natural or holistic things when you can, and I know that like evening primrose is good for,
Black
you know,
cohosh,
helping.
I've heard some
Right.
women will use.
Yep.
Right.
For helping get rid of lumps and that kind of thing. So there's all different kinds of things out there. Not that we're giving that kind of medical advice here, but
I
you
still know if I
just-
have a good Pepsi, I feel it right here.
Yeah. Is there anything but a good Pepsi?
I know. I know.
So, okay, is there anything else that we haven't really touched upon as far as mammography itself goes?
Just that it's really easy to come in and get one done.
And
Really.
communicate. I would say
Yes.
communicate your fears immediately to your technologist.
Right.
Okay.
She can help you. There's things we've done as far as letting the women tighten it themselves. And they might go tighter than we would have ever even gone.
Okay.
But they have the control. And don't ever feel like you have no say in the matter.
Okay.
We have a
know?
great bunch of girls that, you know, we would all take good care of you and nothing to be scared about.
We've seen all kinds. You can't surprise us anymore. And that's okay.
Okay. Well, we touched on before the necessity bags a little bit that Becky has founded this organization. It's called Necessity Bags of Wisconsin, or necessitybagwisconsin.org, and we've been putting that up on the screen. And that is, you brought one with you, didn't
I did.
you? Okay. Can we just kind of show the folks a little bit? It's designed for women who have been diagnosed with breast cancer,
It
and little
has.
things that they may need.
Well, here's the sheet that comes with it that kind of goes
Now
over
I gotta
some
put
of the
my
things.
glasses
I'm
on
sorry.
again so I can read all
But one
this.
of the things, actually near the end, it talks about is when you leave with your bag at the end of your hospital stay, you're walking out with a bag, just a tote bag, not a bag that says, "Hey, I just had my breast removed."
Right.
It's just a fun little tote bag. So the bag itself, it comes with, which is a nice feature. It has some soft little pillows, which these are things that have women that have had breast cancer and mastectomies have said, this is what you
Requested.
need.
Right.
This would make your life better, but you just don't know it.
So this bag has sort of been developed over the years by women who have been down this road and know what made things easier
Right.
for
Yes.
them.
Exactly.
And it's to help make things easier for women who haven't been down that road yet.
Right.
Okay.
And like I said, when you do your self-exam, what do? You put that towel behind your back. Well, when you sit, our shoulders are rolled forward. So if you're going to lay down, just a little pillow maybe under the shoulder so it's not pulling on your incision. Or I'm going to ride home, my husband's driving, I'm going to put this here and just put the seatbelt over it so it's not pressing. I mean, just little things. Maybe my arm's a little sore under here. Maybe they removed a lymph node, so, just a tuck under here. Just nice little.
And these are much
little
softer
soft.
than any regular pillow.
Well, yeah, you're not going to take a nap with it, but
No, but it's very soft.
so there's those. There comes with a folder to keep your papers in. There's a little note card that you can send a thank you if someone really hit the care and you really just want to thank them, or send it to a family member. You're in the hospital and I'm doing great. Just want to let you know. There's other books in here about just different care that things to do to take care of yourself. And there's a pen in here too, to actually, and a notepad. So there's always information. There are extra bandages. And I know in talking with our breast care coordinator, who also happens to be a survivor, she feels this is the best part of the bag.
What is that?
The most important. It is a little tiny ribbon, or not tiny ribbon, but it's that smaller length ribbon. First, maybe we should use different bags you can get open. Or you need a toddler with you. Oh, crying out loud. It's just a ribbon, and you would put it for when you shower. You have drains, and you're draining, and they're coming out of your skin, and they're pinned to your clothes. Well, now you're in the shower. You have no clothes on. So you have the ribbon around your neck. You take that safety pin that's on the drains, pin it through here. You can now shower. Your hands are free. It's
perfect.
holding your drain
All
for
those
you.
little things that mean a lot.
But you don't know you need it.
No.
You know?
That's great.
And different bandages and more tape. And then you have the men's t-shirts. There's one to use at the hospital and one right away when you get home. So you have one that you can wash. And you're not going to wear a bra. So you're just going to have a comfortable t-shirt. You can pin the drains to. You could throw them away when you feel better. You don't care if it gets blood on them, or whatever. Let it go. Some mints and lifesavers. You want something to suck on if you feel your breath, you have sticky breath, or just maybe if you're on chemo or have had
It'll
chemo,
dry you
maybe
out.
you have dry mouth. And there's some chapstick. I guess it's not called chapstick, that's the name brand, but lip balm. And some wipes, Kleenexes, water bottle. And then, of course, I'm sorry, there's just some wipes.
Okay.
Whatever, if one of your drains is leaking, you can just clean up. If you don't have access to a shower, or you're not allowed to shower yet, maybe.
Okay.
Then there's plenty of them.
Okay. Excellent. Okay, so that's the bag, and now you handle, Ann, prosthetics
Right.
For women who have already gone through a mastectomy. They've got their bag, and that's right after surgery, if
Right.
they make arrangements to get that or whatever.
It's brought to them.
Oh, it is, okay. Do they have to, how do they get it? Do they have to, is it automatically brought to them?
Yes.
At Aurora,
Yes.
not necessarily elsewhere.
But they're
But they can
go out and
contact
contact the
someone.
website because Becky's agency is the only one in Wisconsin.
Okay,
So she said she's sent some to like other parts of the state even.
okay, all right. And so all you have to do if you're having a mastectomy is contact the website. I mean, obviously, if you're at Aurora, you're going to get one automatically, but if not, then contact
Aurora
the
Oshkosh.
website. Aurora Oshkosh. Okay, just Aurora Oshkosh. That's a good point to make. And otherwise, contact the website, and they will make arrangements for you to get one. And so you've got your bag, and at what point do you need prosthetics? Does every woman need prosthetics? And what's
Well,
involved in them?
Usually, the earliest I usually see someone, I have seen someone about 6 weeks after their mastectomy.
Okay.
That's pretty early, but depending how they're healing, how they're feeling, they can certainly come on in anytime, but usually we wait at least 6 weeks.
Okay.
They can make an appointment with me. I see patients Monday, Wednesday, and Friday mornings. We have a nice private room, and we just have, it's just a very nice service. I've been doing it about 2.5 years, and I'll tell you what, it is the best job I've ever had. Just to see a woman feel so great when she looks in the mirror, when she has that prosthesis and a bra, she's even again, putting on her shirt, and she's like, oh my gosh, I never thought I'd look like this again. It's just great.
Yeah. Well, it's changed so much over the years.
Oh, it is.
I know when we were setting up this appointment, I was telling you about a relative that I had many, many, many years ago. She's long since passed on, but she had a mastectomy, and way back then, there was nothing. You were just
Right.
flat in that area, and that was it.
Right.
And it was noticeable, of course.
Sure,
But
sure.
you try not to stare, but
Right.
it looks so uneven
Well, and
that
you
your
wouldn't
eye
put-
can't help but be
Right.
drawn to it.
And you know what? It's really sad to see some of the ladies. You know, they're so ashamed sometimes when they come and see me. They just even hate to take off their top and their bra. But then when they leave, it's like I said, it's just wonderful because they're so happy. And we have several different prostheses that we use. We have one company for the prosthetics. We use the Camp Healthcare True Life brand of that, but we do carry 3 different brand names of bras. We have some wonderful new fresh bras, some fun colors. We have like a cherry color, midnight blue. It doesn't have to be, your bra doesn't have to be a frumpy bra. You can look great and pretty. We also, lately I've been having a lot of ladies, we have a tri-leisure prosthetic, which is basically a form with a slightly weighted core in the center.
Did you bring any with you tonight?
I
or-
didn't. I
Okay,
did not
that's
bring
fine.
any. I guess I should have.
Well,
I'm
last
sorry.
year you did.
Last
and
year I did.
And I thought it was so interesting.
I know.
but
I should have.
that's
I'm
all right.
sorry about
That's
that.
all right.
But is it balance? It's
Yes,
just-
it is good for balance with a silicone prosthesis. We always recommend you should always have a regular breast prosthesis. But if it's summer, when it's warm, if you're working out, gardening, whatever, these tri-leisure prostheses, now we bill out, they're $45, and Medicare usually covers one every 6 months, and they're great. They're lighter. But like I said, as for balance, for posture, it's good to have the regular silicone prosthesis. But
or
they're
even a prosthesis at all.
right.
I mean,
Yeah, so, you know, there is a lot of good things out there.
Sure.
For, and I also see lumpectomy patients too, not just for
Okay.
mastectomy, but we have little pieces that you can fill in real easy for lumpectomy patients as well.
Well, let's talk about that for just a moment, and we're quickly running out of time. But
Okay.
what is a lumpectomy for someone out there who is not certain what it is?
Sure.
I mean, we all know, I think, what a mastectomy
Well, the
is.
mastectomy is removing the entire breast. Lumpectomy, now some ladies, you can't even tell. Other ladies, depending on their incision, will maybe just have a piece of their breast gone.
A relatively small piece.
Right,
Yeah.
right. But still, when they put their bra on, they might be a little uneven. So you wouldn't believe what's out there. Just little pieces, little fill-ins that you can put in, and they're even again. When they put a shirt on, if they have a wedding to go to, something they want to dress up for, they don't want to. I think the patients are really self-conscious of that. But the lumpectomy is just where they're removing the cancer and not
And depends
not
on the size of the
entire
cancer.
breast.
If
Right.
you have a large cancer and you still want to conserve your breast, I mean, I've seen in the last couple of years where they've done like a quadrantectomy, where like a whole quadrant of the breast is missing. So when you put
Right.
on your bra, you obviously need a bra to fit the size that you have, but then the other side is puckering, and it just
Sure.
you can see that if you have a blouse on. So just having that filled in,
Sure.
and so no one notices.
Okay.
But I bill the insurance. They don't have to worry about paying right away, paying cash. We, make it very easy for the patient. I take care of getting the prescription for them. They just need to call me and make an appointment, and I take care of everything else.
Now, you mentioned Medicare and now insurance. Our Medicare, you said, covers this.
Well, yeah, I want to tell you really quick.
Sure.
I always tell people to call, because 2 years ago I did have a patient call and said, well, I did have to pay 10% of the bras and the prosthesis. So I do say to call, but
Call Medicare.
call Medicare. But the rule really is they should cover up prosthesis every 2 years, and it used to be 2 bras every year, but now they're saying as medically necessary. So it's such a gray area how many
Yeah.
bras.
Well, if you have a
does
weight change or something, and
Yeah.
Right. So really the best thing is to call your own plan just to see, because you don't want to get hit with a big bill.
Right. So Medicare is one thing. Your individual insurance, of course, is another.
Right.
And just check with your own provider ahead
right.
of time.
Right.
And now, if someone isn't sure how to approach this whole thing with their employer, with their provider, and so forth, are you able to help them at all with that?
Oh, sure. They can simply just give me a call, and I take care of getting the prescription for
Okay.
them. It's no problem at all.
Because
Yeah.
sometimes, their provider may ask a question that they're just not sure really how to answer it.
Sure. Sure.
And so it's, I think, helpful if a medical professional is there who deals with this kind of
Sure,
thing
sure.
day in and day out practically.
Sure.
So,
And Dr. Kiefer, I think, really goes over any questions too in Florette. There's a lot of good breast health specialists at Aurora
sure.
that can help anyone out.
And elsewhere throughout the Fox Valley area as well.
Yes. Right.
Okay, well, very good. We're just about out of time, but any closing thoughts in like about 15 seconds that either of you have?
Call and schedule for your mammogram.
if not at Aurora, somewhere.
Right.
Just get
right.
in, and there's no excuse.
Wherever
Right.
your insurance covers.
That's right.
So, all right, very good. Thank you very much. Thanks to both
Thank
of
you
you.
very
Thanks to the
much.
crew, and as always, we appreciate your tuning in. Hopefully Dan will be here next time, and we will see you next time. Until then, take good care. Keep your eye on us. We've got our eye on Oshkosh.